Hello and welcome. My name is Marsha Mott, and I'm the coordinator of UF Health Wellness University. We have a great presentation today about improving your health. You can submit written questions at any time using the Q&A feature at the bottom of your screen. I will anonymously read your question out loud at the end of the presentation. Our speaker today is Dr. Donoffa Nelson. Dr. Nelson is one of our new family medicine physicians at UF Health. She sees patients in Ocala at our Heath Brook office. She's board certified in family medicine and lifestyle medicine. I think we all feel a little bit overwhelmed right now, and when it comes to improving our health, it's hard to know where to begin. I'm eager to hear more about lifestyle medicine and how it can help. So Dr. Nelson, I'm going to go ahead and turn over to you now. Thank you so much.
Thank you, Marsha. Hello, everyone. Good afternoon. It is my absolute pleasure to be here with all of you this afternoon. I am so excited to just speak with you all on the topic of how to improve your health and where to begin. At this time, I will go ahead and share my PowerPoint slide with you so that you can follow along with this presentation, and then we'll go from there. All right. All right. So I think you are all able to see my screen. So today's presentation is improving your health and where to begin. So just a little bit about myself. Of course, Marsha already introduced me. My name is Dr. Donoffa Nelson, and I am a board certified physician in osteopathic family medicine and also board certified in lifestyle medicine as well. I graduated from the University of Miami in South Florida, and I went to school at Rocky Vista University in Colorado. And then I did my residency training back down in South Florida, and here I am now in Ocala practicing family medicine. And I recently, I think I'm shy about 4 months since I joined UF Health, and I work alongside my colleague, Dr. Lindsay Johnson, and also we have a nurse practitioner in our practice, Elizabeth Hall. And I'm very excited to just be here and to be able to share this information that I think can be so beneficial for so many people. And so I'm really excited about that. So the question is where to begin, and a little bit about what it is that we do. I want to tell patients that it begins with you in mind, of course. Of course, I tell patients you are at the center of everything that we do, especially for myself as a primary care physician. I do wholeheartedly believe that. UF's health care vision, I think, really intertwines with what I believe, and it's basically to create unstoppable momentum toward the goal of improving individual and community health through discovery, clinical and translational science and technology, exceptional education, and patient-centered, innovative, high-quality care. And that's truly what we try to provide our patients with. So of course, how is that aligned? We start with preventative medicine, and preventative medicine is promoting health and well-being and disease prevention, really encouraging patients to come in and get their annual well visits, which are all things that we do here in our office. Of course, we also provide well woman visits, and we do gynecological exams. We provide well annual for our male patients too, where we focus on, things as it pertains to male health and preventative health, offering patients to have colonoscopies or fit tests, and of course, encouraging them to get their immunizations up to date. So those are just some of the basic things when it comes to providing patient care in terms of preventative medicine. And just to kind of delve a little bit into what I'm very passionate about, which is lifestyle medicine. Many people may have heard of it, didn't realize that there was a whole specialty involved with it. I am very proud to say that I'm one in about maybe right now in the United States, 800 physicians that is actually certified I'm really excited that I am able to have this certification so I can educate my patients more. And that is so important to me. So lifestyle medicine is truly addressing the root causes of disease with evidence-based therapies and lifestyle behaviors such as diet, exercise, sleep, social connectivity, and stress. And we're going to get a little bit into that because I know, especially during these unprecedented times we're living in, people are dealing with a lot of these different issues. And I see them every day, especially in my office. And so I want to delve a little bit more deeply into that. And of course, we also treat chronic illnesses and diseases. And I always tell patients that it's so important for me to really get to know them as an individual. I believe in patient autonomy. I believe it's so important to know what it is that the patient is seeking and looking for. I don't believe that medication may necessarily always be the first step. Of course, if it's something that if it's a chronic disease or illness that requires medication, we always, will offer what the evidence says to offer. But I feel a lot of times patients are also seeking to understand what else can they do outside of just taking a pill to solve the issue. So we'll definitely dive a little bit more deeply into that. And so speaking in terms of 6 ways to take control of your health, we talked about it and we'll mention it again. So looking into your nutrition, exercising, stress, sleep, relationships, and substance abuse. And so we'll go even deeper. So when we're talking about nutrition, I believe primarily when it comes to lifestyle medicine, that is typically one of the primary things that your primary care physician should be offering, right? They tell you, please, go ahead and work on modifying your lifestyle. And I find a lot of patients, when you tell them that, they say, well, what does that mean? Modify my lifestyle. For me, it's important to understand, well, what does your lifestyle look like? And so we start off by discussing food. What do you enjoy eating? And oftentimes I find that I don't necessarily have to change so much what the patient enjoys eating. I may have to modify or teach them an alternative way of still enjoying the foods that they like to eat and maybe pairing it with something that's a little bit healthier or finding an alternative that can still satisfy their need. So number one, food is medicine. Believe it or not, food is medicine. Food should be utilized as fuel for your body. I love using the example where I tell patients, you're a luxury. Think of yourself as a luxury car. Your favorite luxury car, if you can have it today, what would it be? And that's what you are. And I always say, would you put the cheapest gas in the luxury car so that you end up, losing out on this expensive buy? You wouldn't. So why would we do the same thing when it comes to the foods that we eat? Because technically food is fuel for our bodies. It's meant to take us from one meal to the other. And oftentimes I find when patients are feeling sluggish and fatigued and just out of sorts, I always go back to the basics, which is their lifestyle. Well, what are you eating? What are you doing? And, by maybe making some tweaks here and there, we can definitely see a change in a positive direction. So I encourage patients, to choose predominantly whole plant-based foods that are rich in fiber and are nutrient dense. Oftentimes, I find that patients are missing out on necessary vitamins and minerals because they're not eating the right types of foods. So I highly encourage patients to really take a look at their pantries. That's usually where we start, where I say, take a look at the pantry, and that's usually you looking in the mirror because that's a representation of what it is that you're putting into your body. So I encourage to eat, of course, foods that, you would shop on the outside aisles for. So things that are fresh, like your vegetables and your fruits, and eating fresh beans. Lentils are absolutely delicious. Eating more whole grains, nuts, and seeds. And of course, talking to your doctor to find out, well, what meals can I prepare? And for me, I absolutely love where I can have a sit down with my patient and kind of work with them and show them, here are the different options. I share recipes with them. I even have programs where I have patients come in and we grocery shop together, have them download an app, and I just kind of show them the foods that they can buy and exactly how it can benefit their overall health. And they absolutely love that, where they feel like, it's not just about someone prescribing this medication and saying, here, be on your way, but I'm actually able to show them how they can make this necessary change. So I think that it's so important. So of course, food is medicine. In addition to that, one of the other things that you often hear is exercise, right? Your doctor will tell you, oh, you know, Mrs. So-and-so, you need to exercise. And you're like, well, how much exercise should I be doing? How often should I be doing it? And of course, talking to your primary care doctor to kind of look at if you have any limitations as to why you should exercise. I will tell you, there are very few reasons why someone can exercise. And in addition to that, I always tell patients we can modify the exercises that they can do. So yes, I even tell patients, you know, what type of exercises are safe for them to do. And I have patients on exercise programs. And I'm so excited because while I've been here within this practice, and even here in Ocala, I've helped so many patients lose weight without having to take a medication to do so. And so I'm always excited to be able to help patients take control of their lifestyle from that standpoint. So regular and consistent physical activity is absolutely key. And I love the word consistent, right? This doesn't happen overnight. It's something that requires for us to work on daily. And for the week, I usually tell patients you're looking on average at about 150 minutes of physical activity, moderate intensity for the week, which really is 2.5 hours. And you could break that up however which way you want. It doesn't have to be the same type of exercises every day. I even recommend, if you can't exercise, then going out, just taking a brisk walk, because that in of itself is a form of exercise that is extremely beneficial. And so there's just so many different things that you can do. And I know with COVID, people are like, well, I can't really go to the gym. You know, I'm too afraid to walk around the neighborhood. And so this is where we've learned to be a little bit more creative. I've shared with patients, you know, some of my favorite videos that I love watching on YouTube of just different individuals doing exercises that I myself can do. And I find things that can be catered to them that they can do. And really, I say anything that grabs your attention long enough, even if it's for 15 minutes, and you just work at it, you just try. That's really all that we ask for, especially to get you started. So I tell, you know, patients, the things that you already enjoy are probably things that you can keep doing. Gardening is a great form of exercise that people don't even typically think about. And so, you know, even sometimes I have patients where they're so busy at work and they're like, Dr. Nelson, I simply don't have time to do it. And I said, well, while you're sitting at your desk, you know, maybe getting up and doing 10 squats. And they're like, what? That's crazy. But I think that it actually makes a huge difference. Just for you to stand up and move is so important. So anything you can do to kind of push through and get those minutes in for the week is so, so important. And it'll definitely optimize your health. The next thing is stress. Oh, how you know, it's been so hard for these past 8 months. I think for so many people, if you were stressed before, you are definitely stressed now. Even if you weren't, you're definitely stressed now. And stress can lead to so many different diseases and problems that people really don't understand that they even have, because it affects your health just overall. It affects your productivity. It can lead to you just feeling depressed and anxious. Of course, being stressed can even, you know, circle back to you overeating and then now being overweight or obese. It affects your immune system, right? Which makes you more susceptible to getting sick, and so much more. So I really think it's important when patients are able to recognize when they're stressed. And oftentimes when they are having negative responses to things, I typically tell them, yep, that means you're stressed. If they're coming in with more musculoskeletal complaints, again, that may mean that you're stressed, right? And then really the goal for me is to identify the stressors that you're having and to teach coping mechanism, different things that you can do to help reduce the stress that you're having. And so again, being able to recognize it, but not only that, finding someone that you can talk to that can help you cope and treat it is equally important. So for me, it's very important when a patient comes in for me to identify and kind of see where they are and really meet them where they are so I can help them optimize their health, especially when it comes to stress. So the next thing is relationships, right? Social connectedness, which right now you're thinking, oh my goodness, like it's the total opposite. How can we connect with people? Well, this is actually one good way of connecting, right? So we have so much advancement in technologies where we are able to find multiple different ways where we could still remain connected with one another. And even though it may be unconventional for some, newer for others, a little bit more difficult or challenging, I always encourage patients, even if you have to stay home, don't neglect the people that you love, reach out to them, call them, talk to them via Zoom or different media so that you can still remain connected to them, because it plays a large role in your emotional resiliency. It is very important that you take the time to still connect with other people. Studies actually show that isolation is associated with increased mortality, increased death. So it's so important that you are connecting with other people. You're still talking and laughing and having a good time despite what it is that's happening around us all in this world. So that's really important. And of course, sleep. Sleep is so important. I talk to patients all the time about maintaining a good sleep hygiene. Many people think that, well, I'm an insomniac, I've always been. And then when we kind of go into talking about their sleep hygiene, we realize that they don't have a very good one. And I always start by telling patients, the bedroom is only to be utilized for very specific things, one of which is sleep. Nothing else should, outside of sleep and having you and your spouse, time with you and your spouse or your partner, again, shouldn't be used for anything other than, because I find a lot of times people will spend time, maybe doing other activities that shouldn't really be done in the bedroom. I have some students that will come in and they'll like to study in their bedroom, or just, again, that really limits how much quality sleep. Your brain needs to register that this bed is where I sleep. And so a lack of or poor quality sleep can definitely lead to a strained immune system and make you more susceptible to illnesses, which we're trying to prevent. Identify dietary, environmental, and coping behaviors to improve sleep health is very important. And of course, substance abuse is another one to help take control of your health. It's very important that we talk about, when it comes to your health, cessation of any tobacco use or other unhealthy habits. Anything that can keep you from living your absolute best life. That's what we're trying to avoid. That's what we're trying to prevent. So any way we can help patients. And like I said, here we do treat and using evidence-based methods to treat individuals that suffer with tobacco abuse or any alcohol abuse. We, have multiple therapeutic modalities that we can use to help patients achieve their goal when it comes to that. So again, with lifestyle medicine, it's very much intertwined with primary care because it's the primary thing that we talk to patients about. As you can see, these are the basic things of life that you really need to live a happy, healthy life. So it allows the body to protect and heal itself by promoting healthful lifestyle choices. My role is to really partner with the patient to educate, guide, support, offer positive behavior changes to help them achieve their goals. I really do place a large focus on evidence-based medicine in terms of how we can approach it when it comes to nutrition and stress management, sleep, and physical activity. I am a huge educator. In my previous life, I like to say I was a teacher. So for me, it's important to really take the time to teach patients and to help them understand maybe some things that they've had trouble understanding before, wasn't really well explained to them, because it's your health. Right? I really encourage active patient participation. What I love about our UF Health system is that we use MyChart. We use a system called Epic, and within Epic, there's MyChart. And I love the fact that if something was discussed and maybe the patient didn't understand, or they have a question, something to follow up on, that they're able to communicate with me directly through MyChart, ask a question, ask for information, whatever it is, they're able to communicate with their physician, and they're able to kind of see their patient portal and know exactly what's going on, which makes it so much easier to provide quality healthcare. So I really do enjoy that, and I think the patients enjoy it as well. Of course, treating underlying lifestyle-related causes of diseases is so important to me as well. Using medication as a supplement, rather than the primary goal, using the medication as a supplement to therapeutic lifestyle changes. So a lot of times I tell patients the goal isn't for me to just keep increasing your medication. It's to get you so well optimized with your lifestyle where eventually, we're throwing out these medications and you no longer need them because you're just doing terrific without them. And oftentimes it takes a while for me to get the patients to believe that. But once they understand that they hold the power to maintain a healthier lifestyle, it's a game changer. And so I really, really enjoy seeing that when that change happens. And so, of course, I always take into consideration the patient's, circumstances, their home, their situation. Like I say, I treat the individual. Each individual that comes in, that's who I'm treating. The therapeutic modalities that I use is very patient-centered and it's very patient centered and it's individualized. So to me, that's really important. So speaking a little bit just about restoring your health. So people may say, well, I already have some of these chronic illnesses that you talk about, you're trying to prevent, or again, lifestyle medicine, does it work for some of these things? So just kind of looking at some chronic diseases in the US. And so 6 out of 10 Americans have a chronic disease, right? 38% of Americans will be diagnosed with cancer during their lifetime. 4 in 10 Americans have about 2 or more chronic illnesses. And even half or a little bit over half of Americans have cardiovascular disease, so heart disease. Some of the chronic diseases that we try to prevent and also those that we treat would include, and not limited to, heart disease, cancer, diabetes, stroke, Alzheimer's, which are, of course, some of the leading causes of death. One of the ones that I come across often, and it's definitely one that lifestyle medicine can help to prevent, is pre-diabetes. Once a patient is pre-diabetes, I really hone in on trying to formulate the best therapeutic lifestyle intervention that I can to keep them from becoming a diabetic. To me, that is so, so important. It's very much a large part of my practice. And so when patients come in, we'll do their blood work and I kind of show them where they are, and then we work our way from there. And so if I find that they're pre-diabetic, they fall within that range, I will, make sure that I do a specialized treatment plan to really keep them from getting over to the other side. And again, how do we eliminate some of the things that can cause chronic illnesses? Some of the things we've covered already: poor diet, sedentary behavior, tobacco cessation. How do you restore health, right? Is there a way for me to restore my health? And I say yes, there absolutely is a way. And like we already mentioned, whole food, plant predominant diet, 150 minutes of exercise, moderate intensity, as long as you're clear with your doctor to do so, 8 hours of restful, restorative sleep, daily relaxation time to help decrease your stress, no smoking, and regular connection to positive people. Whether it's a chronic illness or to prevent illness, lifestyle medicine works for both. And it can help treat and reverse chronic diseases. So just a few tips to help you get started. Especially, I think this is one of the hardest things. Patients are like, well, whole food, plant-based, are you telling me I need to be vegetarian, Dr. Nelson? It would be ideal, but I know for most patients, it's not realistic. So I usually take them through a step-by-step guide. Remember, I said plant predominant diet. So really shopping on the outskirts. I tell patients you want to focus on things that don't have a nutritional label, because that means that they haven't been processed, and probably means you can have as much of it as you want to, if there's no contraindication for you to have it, right? Certain medications you may be on, you may not be able to have certain types of foods, but if not, then, go at it. And so I tell patients, finding a way to incorporate more whole foods into your diet, that's where you want to start. It doesn't have to be just salads. I know salads can get dull and boring for a lot of people. There are so many different options, so many different things that you can try that you would even be surprised that you enjoy, things that kind of go well together. And so I usually have kind of the way I go through with patients is initiate step by step. Start low, go slow. That's kind of our motto. Things that you enjoy, typically, that's what you would want to kind of start out purchasing and knowing that you'll consume it, right? That way it doesn't go to waste. So basically, step one is to just enjoy the foods that you're eating, the healthy foods, and then adapting and exploring after that to expand your palate to see what else that you like. I tell, if you don't, if you fail to plan to fail. So the whole thing with that simply means is planning ahead. Studies have shown people that typically meal prep or plan ahead will do better in the long run. So I tell patients, you can pre-plan your meals, even though you don't cook them, but if you have like your veggies that won't go bad, stored and just ready to go. Meals typically, if they're really wholesome, and they shouldn't take very long to cook either. So definitely batching or planning your meals ahead really will help out quite a bit. And then also make the healthy choice the easy choice, right? It doesn't have to be complicated. You can make some delicious bowls with lots of yummy vegetables, and just, again, you can see some of the pictures that I have here where it can be so simplified, where you really have just a few ingredients that are your go-to ingredients. And I always tell patients, when you're traveling, which we're not probably doing a lot of that right now, you also want to take into account, what it is that you'll be eating when you go out and travel. I always am the one to look up the menu before I go and kind of pick and choose what it is that I'll be eating. That way, I won't have multiple choices to kind of distract me from my goals. And I always encourage families, patients, to include their entire family. You're not on this journey together. We want everyone to be healthy and happy and live a more wholesome life. So getting the kids on board, getting the husband and everyone just on board with this is so important, just for you as well, to get the results. So set goals every week on your journey to improve nutrition. It's okay if you fall off the horse. The most important thing is just getting back on and, planning to achieve this goal. It's not, it's a marathon. That's what I tell patients. It's a marathon. It's a every day. You're going to get better. You're going to do better. You're going to eventually start to reap the benefits and know that you are making the right decision and the right choices. And so this, again, is just, where do I start? Where to begin? And it truly begins with you taking the first step in making a decision to live a happier, healthier life. And of course, I want to let you guys know, and I know Marsha will expand on this a little bit, if you're interested on where to find us, our location is 4730 Southwest 49th Road. For those of you that have a little bit of trouble finding it, it is right behind the racetrack, and we have the Veterans Hospital being built right next door. We're adjacent to the Dillards. So if you know where Dillards are, we're not too far from there. And that is it. So we are open the floor for questions. And I wish you all, thank you so much. And I wish you all a very happy Thanksgiving.
Well, gosh, that was a great presentation. Thank you so much. We have several questions that have come in, so I'm just going to start getting through with them right now. Our first question that came in is, I read some articles about fasting. What are your thoughts on fasting? Probably like intermittent fasting even too. I was kind of curious about that myself.
Absolutely. I think intermittent fasting it's big right now, right? Everyone's like, oh, intermittent fasting. Yeah. And we've seen some amazing results in lifestyle medicine. We actually talk about that quite a bit. And for me, it's very patient specific, right? So I kind of go through, and when I'm treating the individual, we talk about what their lifestyle, how their lifestyle looks like typically. And there's times where intermittent fasting makes sense, right? It's basically just going a little bit longer without eating. So providing your body to utilize its stores. And some patients do well on that, but depending on maybe some chronic diseases that you may have, it may not be the right choice for you. And again, it's how often and how much, right? That's how we look at it. Is it something that should be done every day? Should you limit yourself to eating just one meal? I would say absolutely not. That is not the right approach, because you can pay for that in the long run by slowing down your metabolism. You're not getting enough nutrients, right? That's essentially not the goal. The goal is just to, like I said, your body requires what? Fuel. right? How long can your car go without you putting gas in it? It won't go very far or very long. So it's the same idea with intermittent fasting. If you don't know exactly how to do it, and make sure when you are eating, you're eating the right types of foods that will keep you fueled for the next meal, then it could be detrimental to your health. So I typically will talk to patients, like I said, on an individualized basis and see, is this the right choice for you and for how long? Can we go and do this? The most important thing also is making sure that you aren't missing out on the nutrients that you need, because it can affect your overall health. So intermittent fasting can work great for some people. Again, it's just going a little bit longer without consuming a meal and allowing your body to use the stores. But it's, again, we want to make sure we're doing it the right way. So
Okay.
it does work. It does work. It just all depends.
All right. Thank you.
Absolutely.
I think I'm going to look into that too. That's kind of an interesting topic.
Mm-hmm.
I know UF came out with a research, some research study about that a while back. So I'm kind of curious about that. So when doctors talk about eating predominantly a whole-based plant diet, etc., I just feel overwhelmed. That would be such a huge change. I can't even think about it, this person says. Can you suggest just one, hopefully simple change that I could make to my diet that would be a good first step?
Oh, absolutely. So this is pretty simple. For instance, for breakfast, where you can get a lot of different nutrients just in one meal, right? People shy away from smoothies, but smoothies are fantastic. A fantastic way to just get, again, your carbs, you can get proteins within it, and you can get even your vegetables in there too. So I always like sharing, something simple that you can do. Of course, you think of some of your favorite fruits that you like, and some of even your favorite vegetables. And I always say pairing the vegetable with a fruit that's a little bit sweeter, that'll help offset kind of like the start, the taste that you get from the vegetable. And then if you can tolerate like flaxseed, that has a lot of fiber in it. So adding a little bit of flaxseed or chia seeds to that is great. And then for protein, your almond milk, right? If you're not allergic to any almonds or nuts, then it's a great way to, again, you're getting carbs, you're getting fiber, you're getting protein. So doing something as simple as that, change in of itself. And again, that's I would say probably a smoothie, it's between 250, 300 calories max. And I know people shy away from carbohydrates, but where are you getting your carbs from? That's what I tell patients, right? Is it processed foods? Are you eating a ton of processed foods and that's where your carbs are coming from? Or are they complex carbs? And that's what I kind of get into the conversation of, you want to have more complex carbs. You're getting carbs from your fruits and your vegetables. And that's okay, because your body understands how to process that. Things that are already processed, your body is kind of confused as to what to do with that. And it's not really being utilized as fuel, it's being stored as fat, essentially. So that's why I tell patients, you just focus on making simple, small changes. It doesn't have to be complicated. Again, I could probably give alternatives to things that they enjoy eating and say, well, have you tried or considered this, right? Instead of maybe, again, the starchy potato, the white potato, I say sweet potato. And they're like, well, I said, well, how do you prepare it? A change in how you prepare it can make a huge difference in how you tolerate it. Right? So there's a lot of different things. And I offer, again, patients, I have patients, they love like their fried food. And I'm like, well, are you frying it in oil, like deep fry? I said, have you ever thought about getting an air fryer and maybe switching it to that? And they're like, I never really thought about that. And so there's alternative ways that you can still get the foods that you enjoy eating. You're just not, you're underutilizing the amount of oil that you may have been utilizing before, right? And then there's so many cool recipes that you now can try even within the air fryer that you can do. So again, it's finding, my way is not to just blow up someone's lifestyle and say, I know that's not realistic. So I know it won't work and it's not long lasting. My goal is to teach you ways where you can still enjoy the things that you love and maybe finding an alternative way to do that.
All right. Well, sounds like I need to dig out the smoothie maker in the morning and put an air fryer maybe on my Christmas wish list.
Yeah,
Thank you.
yeah,
Thank you for those
absolutely.
tips. Someone asked a couple questions about sleep. Someone
Mhm,
said, I fall asleep easily, but I have trouble staying asleep. Is there
mhm.
something that I can do that will help work later in the night, or that like something I can take that would help with that?
Okay. So I wouldn't, so going back to kind of lifestyle, I mean, this is great because this is where we get into the conversation of, no trouble falling asleep is fantastic. When we start to think of reasons why you can't stay asleep, there's a multitude of reasons why that can be. And so I always tell patients it's important, of course, to see your doctor so that we can evaluate and make sure that there's no other reasons like obstructive or central sleep apnea preventing you from being able to stay asleep. So oftentimes we see that. I also tell patients, kind of going back into the whole lifestyle aspect of it, I will typically ask a multitude of questions. Number one, in your bedroom, do you sleep with anything on, such as television or any ambient noises? Because that can also deter your sleep. Do you find yourself having, you're waking up because you're having maybe racing thoughts or you just can't shut it down? I oftentimes find that patients will say, yeah, I've been having and experiencing that. So with that being said, then that might lead me into a different direction where I'm thinking, could there be something else underlying going on? I will say one of the things that we find help to improve quality of sleep, sleep hygiene is one of them. And I always tell patients exercising is definitely what studies have shown that can help improve your sleep tremendously. So again, getting patients back into the routine of doing, exercise, even maybe walking like a little bit after dinner, just maybe a few hours before bed, making sure they're not drinking anything more than 2 hours prior to going to sleep, no caffeine late into the afternoon. That's really important because caffeine is a diuretic and that can keep them up if they have to wake up and go to the bathroom. It's not something you can control. Your brain just says you got to go and you got to go. But I find that if we can kind of figure out, well, what exactly it is, then we can help treat it. If it's something that, again, we can treat with a lifestyle therapeutic modality. Sometimes it requires a step further, right? We may need to pair it with something to help you stay asleep. And so there's a lot of different reasons as to why. It's just kind of getting into, well, let's look at all of the reasons and kind of cross them off the list. And then now we can come down to maybe that one that potentially we need to treat. And so that's what I tell patients. Definitely talk to your doctor about it. It is treatable. There's a number of therapeutic modalities to help with that specifically. So
Okay, so another question that kind of came in while you're talking, and
mhm.
you touched upon a little bit, but I just want you to kind of finalize it. Someone says, "What if you've tried all the sleep things and you still can't sleep? What's the next step for that person?"
So I'm thinking you've already seen your doctor and is
They didn't clearly identify that, but they said I've tried all the things. So I'm going to assume like I've tried all the things that are recommended,
okay.
and maybe or maybe not they've not started working with their physician.
Yeah, so at that point, I would say, medication would be probably required if everything lifestyle related you failed. It may require some sort of medication to help stay asleep.
And would a person normally get a sleep study before they take medication,
Yeah, so
or?
we do send patients to see a sleep specialist to figure out exactly what it is that's happening, brainwave activity, something is going on that's keeping them from falling asleep. And so once we've ruled out some of the physiologic reasons as to why, and then we would go the next step to say, okay, well, let's give this a try or that a try. And sometimes we do it in the reverse, but we still have the patient
Mhm.
kind of follow through and do the proper workup.
Okay. Someone asked a question that says, "What food or supplements can give me the best energy boost?"
Oh, food or supplement energy boost. So I will go back to again. I honestly, with patients taking a supplement, I will say I only encourage it if really I feel like their diet is missing out on some of the nutrient dense foods that they need. But two things for sure that improves energy for sure. Going back, which is your nutrient that you're getting from your more wholesome foods. So eating a diet where you're actually getting more fuel from the foods that you're eating. versus eating a diet that's highly processed and saturated fats and unnecessary simple carbs. So decreasing that and then increasing your exercise. For sure, you will start to see that you're getting more energy. You're going to be more energetic. You're just going to feel better overall. And if you're doing all of those things and you still feel like, oh, I just can't shake it, I will tell patients to come in. There are some blood work that we do. And oftentimes when I find that patients are kind of doing everything they're supposed to and they're still not as energetic as they would like, I can almost guarantee that there's some simple vitamins that they're probably deficient in that's causing that. And oftentimes that's what we find. And once we, treat, meaning we give them the necessary supplement, they're back to their normal happy-go-lucky selves and they just keep pushing. So
Okay, thank you.
Absolutely.
Another question that came in is, how much water should we be drinking in a day?
So on average, you will hear most people say, 8 glasses, 8 ounce, 8 glasses per day. I find that patients find that so difficult to just, they're not carrying around the glass every day, everywhere that they go to drink the water. And I usually will say, again, the goal is to get in as much as you can when you can. So people are oftentimes at work and they can't remember to get in enough water. So I usually will tell patients, again, 8 ounces per day on average is pretty good. You're doing okay. Could you do a little bit better? Absolutely. I feel like a little bit more water wouldn't hurt. So I would say that's the minimum. Typically the tips I would give to patients to help them to just drink more water is first thing in the morning, waking up, drink water, right? And some people like to add lemon, which is great if you're into that. That's where I would start. A glass or two, even before you get out the door. So you've already managed to drink 2 glasses of water. And then the other thing, which is a great way to just decrease how much food you're eating, is before you consume a meal, is to drink a glass of water. So you're looking at before every meal, that's another glass of water or so. So you're up to 5 glasses, right? By the time you get home, that's another 2 more. So there you go. You've already had 7 glasses of water for the day, right? So those are just simple ways to remember, oh, I need to drink more water. And the water will actually help you feel fuller. That way you're not consuming as much food as you think you require when you really don't require that much. So that's a great way to kind of just set yourself up where you're just drinking a little bit more than maybe you would drink on average. So
okay, I like that. I think I could try to incorporate that.
yeah.
So a question says, I'm morbidly obese. Okay. Is it okay if I just concentrate on losing weight and leave the good nutrition until later?
So I will say that it is highly unlikely that you will be successful in losing weight without having the proper nutrition. Nutrition and obesity is just, they're on 2 opposing sides. If you want to be healthy and have the normal, get down to a normal BMI, nutrition comes primary. And again, I will go back to just talking about, what foods do you typically enjoy? Like, what is it? I find oftentimes when people are struggling with their weight, it's not just one layer, it's multi-layer. There's a lot going on that could be causing why they're, unable to lose the weight. So that's why I usually will meet patients where they are. Nutrition is a part of it, but it's not all of it, right? So we talk about some of the other factors that could be involved. And again, I tell patients, when you are trying to lose weight, it's important that you go see your doctor to just get kind of like a basic panel to make sure that everything physiologically is okay with you and you're not having limiting factors that's outside of your control that's preventing you from losing the weight. Because then that could be frustrating. For instance, if let's say you have, thyroid disease and you don't know it and you're trying really hard to lose weight and you're not making any strides, that could be the problem. Your thyroid disease, if it's not controlled, well, you may not see any results and that becomes frustrating. And then if you're a stress eater, there goes that vicious cycle starting again, where you're like, eating because you're stressed because you're not losing weight. So again, I think it's just making sure that your health is optimized on all levels, right? But you have to also understand that if I want to see a change in the positive direction, I need to make positive changes. I can't keep doing the same thing and expect the results. So.
Okay. Thank you.
Absolutely.
Someone asked a follow-up question that says, is drinking tea or coffee that's made of water, is that a part of my 8 glasses?
I get that often. I will say I would say yes and no. I don't know if I'm able to say yes and no. Water is water. You can't really say tea is water. Yes, it has water in it. And sure, if you're really into drinking the tea and saying, well, that's me getting some water, I'll give you just about this much, right? I think just drinking, again, pure water, that's what's going to really count for the water, right? And especially with tea, what are we adding? Are we adding some goodies? Are we adding extra sugar? Are we adding, some people like tea, milk, and honey? Like, what are we doing with the tea? Because then that'll disqualify it, right? If you get the water and you squeeze a lemon or you put a lemon tea bag to give the water taste, I'll give you that. Nothing else added. Right. I will say, go ahead, enjoy your water with lemon. Okay. But if it has additives, I'll say, no, you still owe me about a glass or two. And it's the same thing with coffee, right? Yeah. No one's drinking coffee like that.
Okay. We have one last question. Sure. What about wine, red wine, white wine? Which one is better than the other? 1 glass or 2 glass?
So I will say for each, so for women and men, it's quite different. And a lot of studies have some studies say wine is good cardiovascular wise, right? Again, I meet patients where they are, because typically when someone says 1 or 2 glasses, how often are we talking? Again, if you're finding yourself gravitating towards it every single day, and again, people typically, when they say 1 glass, they don't really mean 1 glass. So those are conversations I love to have with patients to just kind of know how much truly they are consuming and is it adversely affecting them. And not everyone can consume really the same amount. What may be, just good enough for one may be too much for another. So it really all depends too on your physiologic health. Like, what does your liver enzymes look like? Do you have any other disease states that could be problematic for? So I usually will tell patients, come in, see me, we can talk about it and see what's the right amount for you to be consuming. But yeah, it can, just everything in moderation.
Oops, sorry about that. Okay, that sounds good. I appreciate the time you've taken today. And I appreciate all the questions and answers that came in from the audience. That's really nice. And I'm going to put up a slide in a second in case you're interested in scheduling an appointment with Dr. Nelson, or some information will go in a follow-up if you are watching this now. So anything else you'd like to add, Dr. Nelson?
No, thank you so much. I had so much fun just kind of sharing this information. I'm so excited to just be a part of the UF Health family. It's been such a great time. Thank you so much for allowing me to share what I'm passionate about, and I'm looking forward to seeing you all. So that's all.
Okay, thank you so much. Bye.
Absolutely.